Hello, I'm Dr. Robert Shapiro from Shapiro Holistic Health and Chiropractic in Stockton, California. And today I wanted to talk to you about insomnia. When I mention that term, I actually like to group that together under three different separate conditions, seemingly separate conditions, but in fact, they're actually related with each other, and a lot of times you'll have all or two or more of those particular symptoms. So what I'm referring to is insomnia, anxiety, and or depression. Many times these conditions coexist. And honestly, in our practice, we've discovered that all three of those conditions have very similar underlying triggers or causes for them. What we've discovered at Shapiro Holistic Health and Chiropractic is that brain inflammation seems to be one of the primary mechanisms behind these symptoms. Let me explain that a little bit. The human body is constantly being bombarded by outside stressors, pathogenic organisms like bacteria, fungi, viruses, heavy metals, pesticides, chemical residues, food additives and preservatives, and even GMO foods like genetically modified organisms can trigger and overstimulate the human immune system. When you overstimulate the human immune system, a common occurrence that happens is autoimmune disease. And we see that this is more prevalent today than it's ever been in the history of our species. But what also underlies that is chronic inflammation. So in essence, you can develop autoimmune disease from this chronic elevation of inflammation. But more often than not, you develop these vague symptoms, and you go into your doctor and they diagnose you with a condition. You get diagnosed with insomnia, you get diagnosed with anxiety, you get diagnosed with depression. What's the standard of care? Medication. So they're going to put you on antidepressants, anti-anxieties, or what we call anxiolytics, or they're going to put you on some kind of sedative, barbiturates, or some other non-barbiturate sedative. The problem with that is that you're merely addressing the symptoms, you're not dealing with the underlying problem. And a lot of times what you'll find is that the condition may stabilize for a while, but it will never go away. Now ask yourself something. If the medication is fixing the problem, why is the condition not getting better? Why is it not going away? Aren't we designed to heal ourselves? Yes, we are, in fact. And so here at our office, when we look at these conditions, we look at it from the perspective of holistic medicine. So we look at the entirety of the human body, not just the particular symptoms. Like I said before, oftentimes we find the underlying mechanism is chronic inflammation. At that point, we need to figure out what's driving the inflammation. Is it a hidden infection? Is it heavy metal toxicity? Is it overburdened with toxic chemicals? Is it chronic stress? Is it all the above? When we find these things, we're either going to try to eliminate them or provide the nutrients that the body is craving in order to provide optimal health for itself. Once we can dial that in for you, we can oftentimes see the diminishment or complete remission of these symptoms. Again, we're not treating the condition, we're treating the person. So we're looking at your individual needs and we're providing those to you so that your body can heal itself naturally. I hope you learned a lot today, and I hope to see you in future videos. Thank you.